In the United States, there are currently 35 million people who do not have access to health insurance and are therefore limited in the health care they can attain. This nation is one of the few countries in the Americas that does not offer universal health care to its citizens.
I would say that the healthcare system, as it currently is right now, is not working very well at all. And what I mean by that is it's a system that allows you to have access to healthcare if you have lots of money and lots of privilege. If you fall into any other categories, if you are someone who has, wage labor, minimum wage, someone who has a job but doesn't have that job provide you with some kind of reasonable health insurance, then your access goes way, way down.
Medical expenses are the #1 reason why people declare bankruptcy in the U.S. Also, the majority of the citizens who declare bankruptcy have access to health insurance.
Even with the passage of the Affordable Care Act, we're still in the same situation we were before, which is that even though you have a health insurance card, it's often not affordable. And this is a really important point because even with your insurance card, you are very underinsured. So you have about 35 million uninsured, another probably 35 million underinsured, and that makes you very, very vulnerable to bankruptcy.
The cost of medical emergencies and the high premiums and copays charged by insurance companies are leaving the population with limited options in order to stay afloat in their living expenses.
In our family, it's contrasted with my husband because he is a Medicare recipient. He's 10 years older than I am. And when he gets sick or hurt, we never have to worry about him seeking care or worry about what it's going to do to us financially, whether or not we're going to be able to still pay our bills or not.
The ACA is here to say hello. Hey, hey. The ACA is here to...
Recently, the legislation known as Obamacare, which attempts to reform the healthcare system by providing citizens more affordable health insurance, was ratified by the Supreme Court, which implies a victory for President Obama's administration.
The Affordable Care Act, often referred to as Obamacare, there are a few important points about that. And one is that it expands Medicaid. So Medicaid was established as Medicare was in 1965. So Medicare covers people in this country who are 65 years and up and older, and Medicaid was established to cover children, pregnant women, and people with disabilities.
The highest court in the land has now spoken.
This legislation also led to the creation of virtual marketplaces, which offer civilians the opportunity to purchase private insurance, obtaining government subsidies, which make them more attainable. Though the ACA has expanded coverage to 60 million people, there are still some flaws.
I'm covered currently by a Kaiser plan that I bought on the exchange. It costs $646 a month for me to pay that premium every month. And yet I still, when I was hospitalized recently, ended up with $6,350, the maximum allowed under the new Affordable Care Act, of out-of-pocket expenses. And it's unbearable.
Although the Affordable Care Act allows states to expand Medicaid coverage, it does not require them to, leaving this decision in the hands of state governments.
We have two dozen states who chose not to expand Medicaid. So here we have a federal mandate that's not being followed through on the state level. So that's leaving out millions of Americans who would otherwise attain health insurance through Medicaid. That is not happening.
Organizations like Physicians for a National Health Program advocate for a single-payer system which would guarantee health insurance for all.
Single-payer national health insurance would leave the delivery of care, of health care services, in the hands of the private world. So I could open up my office, I could practice care and provide care and be a pediatrician, and the government would be the single payer. So there would be no other private insurance companies. It would be a government that basically pays the bill. Now the government gets the money from us, from the taxpayers.
These advocates express the need for the nation to spend the budget allocated to healthcare more efficiently.
In terms of total health expenditures in this country, if you compare the U.S. to every other country in the world, we spend more per capita than any other country in the world. Compared to most countries, more than twice the amount. Okay, so in terms of like GDP, the gross domestic product, we're looking at about 18% of our gross domestic product right now is spent on healthcare. It's not spent efficiently.
Since 2010, the Affordable Care Act has faced opposition from the Republican Party, citing that the subsidies allocated for this measure should not impact citizens' taxes.
Obamacare is wrong for America.
However, the allocation of funds for national defense was 5 times the amount designated for health and education combined. The amount for war expenditures surpassed $520 billion, while the healthcare budget only reached $80 billion.